Hi, today I would like to talk with you about pyloric stenosis or gastric outlet obstruction, which is the narrowing of the pylorus or the lower part of the stomach where food enters the small intestines. Pyloric stenosis affects about 3 out of every 1,000 babies, which makes it fairly common. The muscles of the pylorus increase to the point that food cannot leave the stomach, causing one of the first indications of the problem, which is projectile vomiting. It is 4 times more likely to occur in firstborn male infants, and is also known to run in families. 13 out of every 100 infants diagnosed had someone in their family diagnosed with it previously. It is also diagnosed in the first 2 weeks to 2 months of life, but sometimes as late as 5 months. It is diagnosed with either an abdominal ultrasound or a barium swallow. Also, in conjunction with a physical exam, you can palpate a small olive around where the pylorus is located through the abdominal wall. It can be corrected with a surgery called a pyloromyotomy, which is done with a very small incision and no stitches are needed. Infants can eat after about 3 to 4 hours once they wake up well enough, and can usually go home the day following surgery. Complications that could arise from surgery, one is the late diagnosis. Infants tend to be lethargic and have a significant weight loss, suffering from dehydration usually when they're diagnosed. It's one of the reasons that parents take them in. With early diagnosis, some of the complications can be decreased. Also, post-op infection is another complication to watch for, the signs and symptoms. Difficulty for family can be the late diagnosis and the frustration when, especially with this being more common in firstborn male infants, you have new parents with a firstborn child who have an infant who has projectile vomiting, they're lethargic, they're losing a significant amount of weight, and it may take some time to get this diagnosed. They're very anxious and concerned. You have a mom who is recovering from the delivery of her infant to then be back in the hospital with an infant having surgery. It's a very scary and frustrating time for those parents. Another difficulty for the families can be cost. In today's healthcare, a lot of families do not have insurance. So to be faced with the bills and the added expense of a mom who is off of work for 6, 8, sometimes 12 weeks after delivery, and then to have an infant who has to have surgery soon after, the expense of that can be overwhelming for a lot of families.